Tokyo Professor Stuart Lampard, and also we are happy to have your lecture for Journal Club.
Thank you so much. It's a pleasure to be here as usual, and it's good to see you as my old friend here.
Yeah. How did you start to write the textbook Peri-implantitis?
Well, you see, when this problem occurred in our clinic of peri-implantitis, this was not known generally by the companies or by the dentists, so they said, no, it doesn't exist. Then a good friend of mine that I was working on together, arranging the Madrid Europerio, I was the scientific chair, and he, Jean-Louis Germinaldi, was the Congress chairman, and he was also working with peri-implantitis. So we said, okay, we write the book.
Oh yeah.
But then it took a long time before we were finished.
Okay.
But that's the start of it.
Okay, I'm lucky enough to work to translate English to Japanese. And then another question. Do you know the prevalence of this disease in Swedish population?
Yeah, we can say on patients that have been supplied with implants, you would find around, say, 15 to 20% of the population with implants will have peri-implantitis within a time frame of 5 to 10 years.
Are there any diagnosis tool to distinguish mucositis and peri-implantitis?
The clinical signs are quite similar. I mean, when you probe, it is bleeding, there could be some pus, but the distinction between peri-implant mucositis and peri-implantitis is the loss of bone on the radiograph.
Are there any good solution to treat, or maybe the treatment, how to treat the peri-implant disease?
I would say that for the clinician, the general practitioner, the best thing is to interfere early. So if you can already treat a peri-implant mucositis, you will be quite successful. It works quite good. If the patient has advanced peri-implantitis, it's much more difficult. And even if you do a surgical procedure, you cannot guarantee that it will work in all cases. In the case, some of the cases heal very good, and the long-term prognosis is also good in those cases. But some of the patients will not heal, and then the prognosis is not so good.
Does that mean prevention is much more important than treatment?
Oh yeah. I think for all patients supplied with dental implants, prevention, maintenance is key issues. It's very, very important. So I always recommend the patient that has got implants, I say the first year you need to come to the clinic at least every 3 months.
Oh, yeah.
Then we will see if you are behaving and really brushing correctly. We may say you come 3 times a year, but maintenance is very important.
Yes. If here we have a complicated tooth in the mouth.
Yes.
Do you prefer pull out, place implant, or try to keep the tooth as it is?
My first choice is always to try to keep the tooth. Because even if I would fail, I will buy a number of years with the tooth in place. And we know, I have presented this morning also that even very, very advanced disease of teeth, you can keep them for 25 years. And it could work very, very well.
It's the same as I feel, me as a periodontist.
Yes.
Here that's the same as a periodontist. So thank you for all the time.
Thank you, Sara. Thank you.